So when they're doing an epidural, to get into the epidural space, we're going through other tissues. So some moms have some post-residual pain, and it can stay there quite often. So some of the tissue that they're going through is passive tissue, like ligaments. And if there is scar tissue created on those, all we need to do is get it moving so that collagen can be reformed or tension can be taken off of that incision area. So when you're actually getting an epidural, if we use the model right here, they're trying to get into this space to put the medication. So what they're doing is going through the subcutaneous, so they're going through the skin, the fat, the supraspinatus ligament, which sits on the outside of here, the infraspinatus ligament, which goes internally, and then they're getting into this space here. So what you want to do, because these joints move like this, right? Do you see these little facet joints move open and close, open and close? See how the ligaments that attach to those areas too would open and close? So we want to create motion so that the tissue can start reforming and laying down. The way that we're going to recreate motion is by using a foam roller, a towel, because this area is actually a lot deeper than you would think, so it's actually really hard to get to. You could use a clinic like this clinic where we use some of the needles to get into some of the muscles around there to loosen up the space. So let me just grab this foam roller. But what I would want to do is I'm laying on my back. So usually right around that incision site, I will arch my back up and over. Now I like to roll the legs side to side in this position. You're getting some of the movement in that area. Then I would do it above and below where the incision is. So I'm just using this foam roller as a blocker, trying to get some movement in there. The other thing that I can do too is use a rolled up towel or a half foam roller. That guy goes in there, and then I'm pulling my knees towards my chest, pulling them down away, pulling my knees towards my chest. Again, I'm just trying to get movement. I can make circles once I get up here to just try to open and close the vertebrae in that area. And again, what you're doing is that your goal isn't the vertebrae, your goal is to get to the ligamentous area and start to change the ligamentous area. You could use a lacrosse ball, stick it in there and move around it. It might be a little bit sore when you do it, but it should really feel like slowly as you work it, the tension starts to come out and come out and come out with those. They're fairly easy to get calmed down if you're doing the right kind of things and getting to those deeper areas.
Not bad.